about my experience with green imaging. I kind of have two experiences. One, I want to kind of it's my own personal experience where I was having severe abdominal pain and really could not get into my primary care provider for assessment and referral. I actually went to an urgent care center that I thought would kind of as a last resort, and even there I was going to have to wait several hours. And so even though I was really in intractable pain, I literally just went home and crawled into bed with just very, very uncomfortable. And so what was interesting to me was, although I'm in healthcare and I am insured, I really was at a loss for getting the kind of appropriate guidance, even was as a kind of an insider into medicine. And fortunately, I had met Dr. Dickerson a few months prior, and so I did reach out to her to see if I could, get some imaging for my abdomen. And I really felt the most care I had ever felt, maybe outside of the military healthcare system, to where not only did I have quick and kind of concierge type of experience, but her whole team made sure that, I was taken care of, and then quickly had the results. And so in many ways, I think those who aren't in healthcare are going to be even feel more lost in the system. And we do hear about overutilization of the emergency room. I probably should have gone to the emergency room based on kind of how things unfolded later on. But, me being aware of kind of overutilization or abuse of the emergency rooms for kind of the inappropriate reasons, that was kind of in the back of my mind. But I think what really resonated with me was, even though I was well insured, I was kind of not able to get appropriate access to care in a timely fashion. And so having relationships with networks and providers that are kind of from a more transparent and direct relationship is absolutely critical. And I think that that's part of the problem. If people feel like they do not have a partner in their healthcare, then they're going to just go to the ER, and obviously they do share some of the burden, but the employer also will actually experience a lot of that cost as well, especially if it's not needed appropriately. And so, my personal experience, although it's an anecdote, absolutely, I think, is the common experience for many people when they're in an acute medical issue. And then I also think about it from a chronic medical condition, and I think that's where direct primary care really can make a big difference. We haven't spoken necessarily about that here, but I think a lot of primary care doctors in the traditional health insurance model have to see a certain amount of patients per hour for various reasons. And so it's hard to build a rapport with that primary care provider in a very short time period. And so I think really the direct engagement with healthcare providers, whether it being primary care, imaging, and then also I think the other big spend is pharmacy benefit. But there really needs to be a paradigm shift in healthcare provisions to where you have more of a direct model. Just like if you were going to buy anything else in your life, you would know the cost, see the value, and decide to purchase it or not. So, Dr. Dickerson, I don't know if I didn't have really my head screwed on very well back then, but I don't know if this is commonplace for you and your team and your network, or if I just happen to remember our relationship and kind of engage you on a kind of emergent basis. So I don't know. I never got to ask you if that's more common or not. So.
Now, we really consider ourselves providing direct radiology services. We think the radiologist should be around. My background is with multi-specialty groups, and the multi-specialty groups I worked with paid more to have in-house radiologists that they could come down and look at images with. They saw that much value in being able to discuss the cases with, and that they would even bring the patients into the reading room and say, he hurts right here. What do you see? And that's better care. And so we are very actively involved in our practice. When orders come across in our referral management system, we're actually reviewing the orders, making sure the patient's getting the appropriate exam. If it's ordered with and without contrast, and it only needs to be without contrast, we're removing that contrast and that extra radiation dose and that extra expense. And if an ultrasound could do the same job or do it better, we go back to the referring physician and discuss that. We're right there on the platform with a group chat where direct primary care doctors, near-site clinics, on-site clinics can actually chat with us and say, what's the most appropriate exam to order here, or what did this mean in this report? We can ask patients questions. It actually has a secure HIPAA-compliant messaging system that comes across like a text to the patient, and I can say, hey, when you had that contrast reaction 5 years ago, what happened? Did you just have a little throat swelling, or did you actually, have hives? What happened there? And so it really it changes the way radiology services are provided. And we really found that when that app failed for patients scheduling themselves, that's when we realized we had to have a really robust concierge service. So that team effort that you felt about getting everything, not only getting you scheduled, but getting the report across to you, that's very commonplace. And if you look at our, and I'm bragging, but our Net Promoter Score is 90.2, which is world class, despite the fact we're frequently relocating the way that, changing the way people acquire imaging. And our Google reviews are 4.9, and our concierge are almost always called out by name in those reviews. So I think that reflects the difference in the way we practice.
And I think that makes a huge difference on outcomes. The psychological reassurance that you're not just a number, or you're not sure if everything is in, or when am I going to get the result. Reassurance and psychological, feeling safe, or at least that you matter versus just a business transaction makes, I think, a huge difference in medicine. And I think that's a symptom of maybe the kind of the current model where there's a lot of third party or middlemen in that transaction. And so, I can see people getting frustrated, whether it's kind of routine chronic care or just getting a physical. I think a lot of our discussions with COVID are, hey, if you haven't gotten a physical in the last year or 5 years, now's a great time, because it would be really helpful to know if you have any of these medical conditions that make you more predisposed to, COVID, obviously for this pandemic, but it matters for your quality of life and your health span and lifespan. So, I could absolutely see why your network continues to flourish and your business model does as well. So I'm a customer and a huge fan. So thank you very much.
Great promotional statements, Dr. Terry.
You can't pay for that.
You can't. We didn't. I promise. So when you think about, both of you just said the words concierge medicine. I think, just to go back to your case study briefly, Dr. Dickerson, if you could I think people hear concierge and they think expensive, or they think elite, or they think I can't do this or access this. And we'll get into some considerations for employers in just a moment. But can you just address that directly a little bit?
Yeah, there are a couple of, direct primary care likes to differentiate itself from traditional concierge medicine. Concierge medicine frequently is something that's layered on top of an insurance plan, and somebody pays up to have better access to their physician. Their physician takes a limited panel and may include some screening exams and some extra services in there. Direct primary care is different in that the whole idea is we're just not just looking at a patient's physical health. They're getting paid a monthly fee. It's enough that if they have a certain size panel, they make a decent living without having to see 22 patients a day. They can take 24/7 care of these patients. They take calls at night. They do everything they can to not only manage the patient's physical well-being, but also their emotional well-being and also their pocketbook. And they find resources, whether a patient's insured, whether a patient's on a health sharing ministry, whether a patient's uninsured, they find ways to decrease the out-of-pocket spend. And, that is super important because really, if we look at it, and there are different numbers tossed out there, but about 90% of care can be handled at the primary care level. If that happens and people aren't seen in the ER, and what happens a lot of times with the DPC doctors, if they have to send somebody to the ER, they're also going to make sure their imaging exam doesn't have to be repeated, that it goes across, their labs go across, so that we're not providing redundant care. And they monitor, they want feedback from that doctor, the ER doctor, about what's going on. They stay engaged to make sure that that patient is well taken care of, even when it's in kind of the more traditional space. And so what we're finding in health plans is it's anywhere the estimated savings so it's hard for employers to see this because it's something they're paying for on top of what they're already spending on healthcare, or what they perceive they're already spending in the, for the PEPM, which is the per employee per month that they're paying to have a network for their employee health plan. But what they're doing is investing, because the savings down the line in the health plan are 20 to 50%. And so it depends on, how incentivized employees are to use the DPC. A lot of times they'll use it kind of as a telehealth experience, love it, and then continue to get all their care there. We love that. We like that model as well for the zero out-of-pocket imaging. They come for their mammogram in a low-stress time and, have a great experience, and then they're much more likely to use us when they're, having abdominal pain and healthcare stress. And so I really believe in the subscription-based primary care, whether that's an on-site clinic, whether it's a near-site clinic, whether a lot of this is happening by telehealth with larger employers who have a wider geographic range. Some of this does have, even if it's with the DPC, some of it has to be farmed out to other DPCs or has to be by telehealth. And a lot of DPC work does happen by telehealth, but there are really great options out there that not only, and it also takes away this idea of a health plan being a year-long thing. Everybody used to think of, we don't want them to get to their deductible, or we're going to have to spend that. And, it puts healthcare into I'm investing in the future of my workforce. And I'll tell you what, right now, during COVID, during the pandemic, it is a much better thing to have your people have resources where they can go affordably get care 24/7.